Hello and welcome to our short video on hearing loss. This short presentation will introduce the Audiology Tayside Severe and Profound Clinic and lay out some important information about your journey so far and some of your options going forward. The amount of hearing loss someone has is ranked as mild, moderate, severe or profound. Examples of sounds which fall into the severe or profound range include 70 decibels, the average volume of a vacuum cleaner at a distance of 1 metre. 90 decibels is the average volume of a pneumatic drill at a distance of 15 metres. 100 decibels, the average volume of a music loudspeaker at a distance of 1 metre. When you have a severe to profound hearing loss, you are only able to hear very loud speech or loud sounds. People with severe hearing loss cannot hear speech at a conversational level, and with a profound hearing loss, loud sounds may only be perceived as vibrations. The degree of hearing loss often varies for sounds of different pitches, with best hearing in the low pitches in most cases. Essentially, if you have a severe to profound hearing loss, you are the hardest of hearing. In the first video, we looked at the impact of hearing loss. When you have a severe or profound hearing loss, these are some of the effects people describe. Communication can be stressful. Listening is tiring. Mishearing things can be embarrassing. You can grieve losing your hearing. You may have to change the way people communicate with you. Hearing loss affects all areas of your life, socially, at work, at home. You can find that you withdraw from situations. It can reduce your confidence. It can take away your independence. In the previous video, we discussed the ear very broadly. The main thing to consider when you have a severe or profound hearing loss is that significant damage has often occurred in the ear or the hearing nerve. Technology, such as hearing aids, will have limited effects because of the amount of damage that has occurred, and so you need to consider how you want to manage your hearing loss as broadly as you can. What do I need to consider as someone with a severe or profound hearing loss? Hearing aids are only part of the solution. Other strategies, such as lip reading, communication tactics, and assisted listening devices need to be used to get the most out of communication. Hearing aids may not be able to provide audibility of sound across all areas of the speech spectrum with this level of hearing loss, and so visual information from looking at people's faces is even more important during conversations. But it is vital that people speaking to the person with hearing loss do not exaggerate their lip patterns or shout, and they should be succinct in what they want to say and not waffle. Using closed questions such as, "Did you say 13, 1, 3, rather than open questions such as, "What number was that?" Technology options can be very helpful if you have this level of hearing. The use of subtitles for TV, cinema and theatre shows, text messages, emails and instant messaging can help communication. The use of text phones. A text phone allows two-way conversation by text. In an emergency, text a message to 999 and the emergency services will be able to reply to you. www.emergencysms.org.uk. Using vibrating and flashing technologies. See equipment information below. App technology can also be very helpful. We currently upgrade hearing aids every 3 years to ensure we are on technology which can be replaced if it was to break down. But, as you can see, there are lots of other options. Some of these are discussed in the first video, but there are some specific ones we want to pick up and explain further. Equipment. Some equipment can be used alongside your hearing aid and some are independent of them. We would always advise you to consider if you are able to know your smoke alarm, telephone and doorbell are alerting you. If not, then we can provide advice on where you can get this equipment, either for you to hear or to feel. Equally, lots of people describe struggling to hear in background noise. One of the key ways to help with your hearing aids is considering purchasing a system called a hearing aid streamer. These devices work with your hearing aids and often include a discrete microphone which can be placed nearer the speaker. This microphone is key in reducing the distance between your hearing aids and the speaker and making it much easier to hear. Again, please ask us about the different streaming devices available with your hearing aid to purchase. Hearing dog. Some people apply for a hearing dog to help with some of the effects of hearing loss. They can help to reduce the feelings of isolation, fear and exhaustion. Rehabilitation and deaf groups. If you would like more contact through joining a friendly group run by and for people with a hearing loss, or if you want to get more information or support from others with hearing loss, then there are some local groups we can put you in contact with. Cochlear implants. Cochlear implants provide useful hearing to people who get little or no benefit from a hearing aid. They consist of an internal part surgically implanted in the mastoid bone behind the ear, with electrodes inserted into the inner ear, and an external part called the speech processor. We have a further video from the British Academy of Audiology which tell you about these. This may be something at this stage you want to get further information on, and we can provide that, but please also note that if we refer you to be assessed for a cochlear implant, it is an information gathering exercise and you do not have to be fully committed at that point to going ahead with one. We would recommend you consider taking up the referral so you can get much more information specific to your circumstances. Our local hospital for this is Crosshouse in Kilmarnock. Because we know this is such a big decision for many people, we will often ask about it a lot at your appointments to check where you are at. Communication support is provided by communication professionals or language service professionals for hard of hearing, deaf, deafened, deaf and deafblind people in situations such as work meetings, job interview, GP consultations, courtroom, etc. We should have discussed your communication needs for your appointment with you, but we can also give you information on where to find it from other situations. Sign language. British Sign Language, BSL, is the sign language used in the United Kingdom and is the first or preferred language of some deaf people. There are 125,000 deaf adults in the UK who use BSL. Most people who use BSL are born deaf. It is not usual for people who lose their hearing later in life to learn BSL, but the use of facial expression and gestures can be helpful during communication. If you do want to learn this, then please ask us for any information leaflets and where you can do so. That brings us to the end of this video on severe and profound hearing loss. We look forward to seeing you again on the Severe and Profound Clinic. Please note down any questions you have from watching this video, and we will discuss these with you in your next appointment.